So, Carl, are we live?
Yes, Doc.
So I hope that sounds better on your side. We actually paid for some of this copyright-free sound, and on my computer, it doesn't sound that great. It sounds good otherwise, but again, your comments would be welcome. Today, we're going to be talking about a serious COVID-19 condition that's pardon me, Siri heard me and started talking back. A serious COVID-19 issue that's occurring with kids. Now, that's the opposite of what I've been saying from day one, right? That kids don't have serious illnesses, or at least haven't been recorded. This started actually a few weeks back. Some people started noticing it in the UK. At the end of the day, I think we're going to find that this still appears to be rare. So the rule, maybe this is an exception that proves the rule. But we're going to go over an article that actually covers some of the occurrences in the UK. So today's about the COVID-19 condition emerging in children. Upcoming topics: do sunlight and microwave kill the coronavirus? Inaccurate death certificates to increase during the COVID-19 outbreak. Privacy issues associated with contact tracing apps. And again, we have several other topics coming up. As soon as we can get our system set up where Chris understands that he can go ahead and add those upcoming topics. Previous topics, in case you haven't seen them: the race for a COVID-19 vaccine. As usual, we've got a lot of comments about that. And as usual, anytime the discussion of vaccine comes up, you get some vaccine haters out there. Guys, I understand there have been negative outcomes from vaccines. That's very different from looking at the world pre-vaccine. And you just have to go back to early America when smallpox, for example, was a major issue for health. And that doesn't cover, that's just one minor example. Now, then we've got other videos. For example, which states are covering enough COVID-19 tests? Everybody's getting excited about getting back out into society, getting back out into the workplace. But you know what? We need to have some guidelines. We've talked about guidelines on those, and one of the major ones is having control of your infection rate. Having a rate over 10% and then going back out is probably a fairly dangerous thing, because it means that A, you don't have enough testing to do contact tracing, and or B, you're only testing folks that have the virus, and or C, that there's still a lot of people in your area that have the virus. So we covered a little bit of clarity on that issue of how many states are testing enough. And gosh, over half of the states we covered had rates over 20%, not 10%. We've covered items like coronavirus attacking the immune system, T cells and leukocytes like HIV. And again, HIV doesn't attack leukocytes so much as it does T cells, but we cover that in the topic. Is it safe to eat takeout? Mysterious blood clotting complications. You know, the young healthy man, the Broadway actor that lost a leg due to clotting, and young people, as in their 30s, otherwise healthy, getting not minor strokes, not only strokes, but not minor strokes, very serious strokes. So there's some interesting things coming up regarding coronavirus, and these are all things that we have covered. I have to show you this, and I'm thinking about ordering maybe a couple more of these and doing a review of these. This is a pulse oximeter. I got this one. This is the FL400 pulse oximeter, and couldn't get it to work. Couldn't get it to turn on at all. And it gave me a number in the instructions to, not a number, an address to write in the instructions if it didn't work. And that one had relatively good reviews. And I'm going, So buyer beware. Now, again, we've covered this update a couple of times. Significant announcement about remdesivir, a antiviral that's been developed for HIV. Again, maybe a 30% decrease in hospitalization duration, and maybe 25 to 35% decrease in mortality. Those are significant numbers, but it's obviously clearly not a cure. We have not only preventive medicine like we usually do, but urgent care services available if you're having trouble getting them during the lockdown. For those of you who've begun to make the connection that, you know what, this is not so much a virus, but this is sort of like strokes and heart attacks. It's one of the tools used by the big culprit, the big pandemic that's going on, that's really ruining our health and our lives, and that is prediabetes. COVID-19 is just another opportunity, like heart attack and stroke, for prediabetes to cause arterial inflammation and then disability and even death. Unfortunately, over half of us have it, age 30 and beyond. So are you feeling lucky? Because over 90% of us that have it don't know it. There's a great way to find out. We've done some things in terms of setting up webinars to help you focus specifically on, am I one of those folks that has it and doesn't know it? There's a lot of folks out there that have CIMTs. Their doc could not interpret it, did not know how to interpret it. So the typical response was, well, this is worth nothing. This is worth a whole lot. This can be life-saving. Excuse me. And if you'd like to know a little bit more about how to interpret your CIMT, we've got a webinar for that as well. The book's still on its way. Again, bottom line, and I'll keep you posted on it, but the bottom line is, if you're looking to predict a heart attack, tell whether or not, am I going to have a heart attack? Stress test is not the way to do it. So we'll get to the disease with kids, COVID-19, right after Carl gives us the intro water ball.
When I sent this morning.
So look who we have with us here today. People have been asking for you, Janice.
I'm popping in today because this is a topic of interest to me.
You are into kids, are you not?
Yes, I am.
So what are your thoughts about this? You sent me this article. I mean, we've got the coverage, the deck on the other article, but as you noticed, you sent me this last minute.
This article came out this morning. as well as another one in Louisiana last night about children with COVID-19. The Louisiana article covered a 12-year-old that went to the hospital that had a heart attack en route that tested positive with COVID-19. And then this one talked about the 15 children in New York City with COVID-19, 5 of whom ended up on the ventilator. And what we're going to talk about today, what the slide deck is on, are the differences in symptoms that we see in children.
You want to get us started?
Well, some of the differences that I'm not going to read these slides. I'll let you go back and talk about this a little bit, but they're seeing toxic shock type of symptoms, Kawasaki syndrome, children starting out with more kind of abdominal intestinal pain. And they are noting that it's inflammation of the arterial wall as well as shutdown of certain organs that are hallmark. One thing I found interesting a long time ago, you had mentioned conjunctivitis, and that is also part of this syndrome with the arterial wall inflammation.
You bring up Kawasaki disease. You've done a lot of pediatrics, not so much medical pediatrics, but you've focused on pediatrics most of your physical therapy career. For those of you who don't know, Janice has a doctorate in physical therapy and a doctorate in health coaching or health education. So I know you've seen kids and heard about them. Any comments about Kawasaki disease?
I'll let you explain that from the medical standpoint.
It's not an uncommon disease. It's an inflammatory process of the arteries that can be seen with viral illness. So as you and I mentioned, it's not entirely surprising that you may occasionally see that with this. I do think it's worthwhile for me to cover a little bit more about what we had in the slides in terms of helping orient people to what's going on. You see, Britain's Pediatric Intensive Care Society issued alerts to general practitioners and children's intensive care doctors. The reason was a significant increase in children admitted to ICU in recent weeks, suspected to be due to a new and serious coronavirus-related condition. There was a growing concern that COVID-19 related inflammatory syndrome is emerging in children in the UK, or that there may be another as yet unidentified infectious pathogen associated with these disease cases. Now, doctors in Italy and Spain have also been warned to look out for this condition. And you see it on Business Insider, MSN. As we mentioned a minute ago, you saw one on the New York Times today. The symptoms include a toxic shock syndrome, atypical Kawasaki disease, abdominal pain, and GI symptoms, which you mentioned a minute ago, and even cardiac inflammation, and potential even a heart attack in a young, what, a 12-year-old?
A 12-year-old.
Kawasaki symptoms include a high temperature, lasts for more than 5 days, rash, swollen glands in the neck. Simon Kenny, the NHS England's National Clinical Director for Children and Young People, said, "Thankfully, Kawasaki-like diseases are very rare, as currently are serious complications in children related to COVID-19. But it is important that clinicians are made aware of any potential emerging links so they are able to give children and young people the right care quickly." Little is known so far, and doesn't appear to be that widespread. Again, it appears to be rare, as we've mentioned a couple of times. The number of children affected is small. Condition is observed in children with positive PCR. Remember, that's the genetic test for viremia, virus in the blood. That's why scientists are not entirely sure if these symptoms are caused by the new coronavirus or something else. I personally suspect that this is a rare response to the coronavirus itself. Other comments?
Well, and I think 2 points to bring out. There are some prediction that we're going to have 3,000 deaths a day with 100,000 newly infected people. And
you mean including adults?
Yes, including adults. So, there's certainly children will be counted among that statistic. And the other thing is, as we see the states, I was going to say lower the requirement or amend their requirement about physical distancing, we're already seeing it even in our own community. We see kids in pools, in their backyard together. We see kids in a fort. We didn't see them even a week ago. And now they're in groups playing together. For some of them, they're nearing the end of the school year. And that's just going to increase as they have more time. So I think it is, even though it's a small statistic, it's very important that parents think about that as they let their children play with other kids, and we don't, are the other kids who are the members of their family? Are there healthcare workers? Are there people that are in the grocery stores? There's still a lot of room for this infection to spread.
No question. I recently, speaking of that last comment you made, I've seen a couple of articles. I can't remember, was it New York Times? The headline was what the, oh gosh, what was, I'm having a senior moment. What the herd immunity proponents are failing to tell you. Have you seen that headline, seen that article?
I think I sent it to you.
Okay, did you read it? Oh,
actually, a patient of ours sent it. Yeah, it was an op-ed in the New York Times on Sunday. Go ahead.
And it's obviously, yeah. Oh, yeah, that was one of our patients. Yeah. Saw that, sent that. And the issue is, yeah, there's going to be a lot more deaths and infections than I think our culture can accept if we go that route. Have you seen any updates on the telephone data indicating how active the lockdown actually is, how active people really are?
I skimmed through one of those articles and sent it to our team.
I saw that it seems 2 weeks ago now. Yeah. And even at that point, it appeared that the lockdown, quote, had a lot of leaks. And just from what we've observed in our neighborhood, like you mentioned, it appears that the leaks have grown dramatically.
I remember a comment you said about it. You said, so the people at the beach have their cell phones on to trace people that had COVID nearby as they go out into the ocean.
Yeah.
Do you remember saying that?
Yeah.
So it's great that there's technology for that, but how widely it will be used, you have to have your telephone on you at all times as well.
Right. And that was the point that I was making, that
yeah,
you don't have to carry your telephone. When they actually did these outbreak investigations and this contact tracing in places like Singapore, originally they gave them a phone and they said, look, we're giving you a phone, we're going to give you a camera, and we're going to ping you without warning, and you have to be here, and you have to be able to show yourself on the camera. And they made a point that once you start getting that aggressive, you've sort of bought this person's care in terms of there's some implication or implied responsibility that you'll get food and sustenance to that person because they can't get out. So, nothing simple. Anything else before we show the videos?
No.
Okay. Carl, are you going to show the video? You want me to click it?
First, it's important to say that COVID-19 very little affects children. We know that from all countries in the world, that they tend to not get this condition, or if they get it, they have very few symptoms. But very rarely children can get very sick. And our pediatricians in the UK have noticed an unusual condition which looks like a syndrome called Kawasaki disease, which is a type of vasculitis. but it's a condition where children can present with abdominal problems, they can present with neurological problems and seizures, they can present with rashes, essentially, and they can present with shock and collapse. And it seems to be the body's immune system reacting to something and causing this, what we call vasculitis, inflammation of the blood vessels in multiple organs. We're not certain that this is linked with COVID-19, but we certainly need to assume that there's potentially a link and follow that up to start with. The cluster in London, true, not all of them have tested positive initially, though our tests for COVID are not perfect. And it's certainly known that children can test negative at one stage and then test positive from a different body fluid slightly later. The working hypothesis is probably because the cluster has been noted at the moment and quite a number were COVID positive. The working hypothesis is that it is linked to COVID. However, we can't assume that.
Off the screen here. So a couple of other comments before we get into the Q&A. One comes under damned if you do, damned if you don't. As you pointed out, I think it was yesterday, Janice. Our email list was declining, and subscriber amount was declining a little bit, and it was appeared to be associated with putting all these emails out, these daily emails. So we said, you know what? I don't think we're going to be able to slice up the two segments. It's called segmenting in marketing, and get the folks that want to hear about it on a daily basis, but not bother the people that don't. We've got some people that just want to hear about supplements, some people that just want to hear about heart attack and stroke, cardiovascular inflammation, some people that just want to hear about sleep, some people that just want to hear about dementia, and we're not ready yet to do that level of segmentation. When we started doing this weekly thing, we started getting pushback on that now. And so we're going to go ahead. I sent an email to Michelle and Chris this morning to say, look, guys, I know we don't have the right structure set up at this point, but we do have software that will support it with HubSpot. So they're going to work on that and see if we can start getting that daily notice back out to you. Other comments before we start?
Yeah, I tried to get in on the one that provided the topics for the week, and it took me into a membership tunnel that I couldn't get out of.
Yeah. And
so before we had the link on the daily email, which I think was a little more useful. So we'll see how it goes.
It's always something, isn't it?
We're healthcare, not marketers, but you're trying to do both.
Yeah. You want to get that information out there. So let's start with some Dave Murphy. Good morning, and how are you? And Joe Riley, howdy. Good morning. Fennell Hicks is in just in time. Good morning, Fennell. Doug Thompson. Good morning, Doug. How are you? I sent you and Aaron an email last night. I'm confused on when you guys are setting up your regular meetings as well. I think you've gone through some of the same changes we have. Nancy in Canada, good afternoon. Wonder which time zone you're on. Sounds fine, good. Thanks, Doug. Vitamin D. So, you know, Joe sent us some information, and I did mean to comment on that this morning. Thanks for the reminder. There was a video by Eric Berg. You know, your sister confuses me with Eric Berg sometimes. And he was talking about vitamin D. He quoted a study. It was like a 3-minute video. Joe, I don't know if it got cut off on what I was looking at or if it just wasn't there, but I couldn't find the actual article itself. It sounded like it was a fairly obscure article. Here's the bottom line, though. It looked like vitamin D was knocking it out of the park in terms of risk factor for serious COVID-19 disease. In other words, folks that had normal levels of vitamin D did not have a problem. folks with low levels, I mean, it was like almost everybody with COVID-19 related disease had significant vitamin D deficiencies. I don't think that's totally surprising. What did surprise me was how dramatic the data was. And usually if you get something that dramatic, Joe, it's worthy of a very high level medical journal. Not seeing it in any of the high level medical journals, not hearing a lot of it on standardized news. Is that because they just don't care about vitamins? I don't think so. I think that I'm a little bit skeptical of the quality of that article, but I'm not at all skeptical of quality of vitamin D. We've been recommending that for years. And yes, it does appear, evidence would indicate that yes, I would clearly take vitamin D. I've got several videos on it myself. Be careful, just like many other things, you can get into trouble with it. People have actually died from high levels of vitamin D. That's, if you go through the science, I haven't seen it below 105. Now, yes, I'm talking about a blood level, serum level of 105 for vitamin D. I actually had a patient come to me last year with a level of what, 110, 115? Obviously, for me, that was a panic level. We got back in touch with that patient immediately. We found out she'd been hearing that vitamin D gospel, got a prescription from another doc, and it's not clear whether the doc miscommunicated or whether the patient didn't hear her, but she was taking 50,000 international units a day. It was meant to be per week. Now, if you talk about supplementation, and I think people that are watching this and thinking about COVID-19 prevention, what's the best dose? There has never, I have not seen anything associated with any negative outcomes with people taking 5,000 international units a day. So for my patients that are getting started and we don't have a blood level yet, I recommend that all of them just go ahead and at least take the 5,000. So it was a great pickup, Joe. Thank you for making us aware of it. No matter what level of quality of the article, no matter what you'll hear in the future regarding vitamin D, I do recommend taking 5,000 international units and then start getting blood levels. Kid Poker 007, sounds fine, great, thank you. Dave Murphy, I see Quest has an antibody test available, $119. I don't want to know that badly. It's a good point. Thank you, Dave. And yes, several of you have asked for Janice to come back, and I appreciate you coming back today.
And I'm going to leave a little bit early because I have another call.
Okay. Brian Crane, let's see if we can get some questions for you. Brian Crane, what is a safe SpO2? I'm not sure where the S comes from. Maybe but if you're talking about partial pressure or oxygen saturation, maybe that's what you mean. 94, 96 and above are normal, unless you happen to have lung disease. If you have no lung disease, and then you come down with coronavirus infection, and your blood O2 sats on the oximeter, mine that doesn't work, and Joe's that does. If you start getting down around 94, you ought to just call your doc and make them aware. You get anything below that, you need to go on into the ER, because you're probably starting to get into some of that problem where we lose our O2 oxygen saturation and we're just not aware of it. That is the whole purpose for that oximeter. Jose Fonteo, Dave, I got my antibody test done last week at Quest, still waiting on the results. Yep, that's another issue. Now, what happened to El Shaddai? Okay, so El Shaddai, recognize at least the first part of that name. My doc put me on 10,000 international units of D3, 15 milligrams of zinc, picolinate, told me to take 400 to 500 milligrams of magnesium when I take the vitamin D. He's a professor at neuroscience at a large university. Thank you for sharing that. And those recommendations are not uncommon. The zinc, the vitamin D3, and magnesium. Dave Murphy, Jose, it sounds like they have a 98% correct rate, so that's great. El Shaddai treats my MS. Oh, well, thank you for sharing that piece as well. But it's interesting how you get a correlation with prevention as well. My oximeter is in my best, no problem so far, fingers crossed. Good morning, Janice.
Good morning.
Silver D, it's rare and symptoms differ from coronavirus. Stop the fear mongering. Well, you know, I'm tempted to react to that. I think the whole purpose for this was the opposite of fear mongering. You are going to hear about that in the news, and the underlined point that we made and will continue to make is it is rare. I think what that does, I think that's an exception that proves the rule. Dave Murphy, is it possible that cardiovascular inflammation could be related to a predisposition, either dietary or epigenetic, to cardiovascular problems? Well, of course, Dave, yes, no question. If you look at folks that have, we've talked about a book many times. It's called Beat the Heart Attack Gene. It was written by Brad Bale and Amy Dunning, friends of ours. We've worked with Brad a good bit and with Amy some. They're referring to 9p21. The p21 area on the 9th chromosome. That started out years ago being referred to as a cancer gene. And then about the time that Brad and Amy wrote their book, it had been found out to be very much associated with heart attacks and strokes. If you look deeper, and more recently, it's become known as a prediabetes gene. So the vast majority, there are a lot of different variations within that p21 area of the 9th chromosome that can cause this. But the vast majority of them are prediabetes-related genes. Now, there's also one other component. There's one component within 9p21 which causes inflammation, replication of the muscle cells in that lining of the artery, that muscle layer.
We've also looked at the comorbidities. We looked at Louisiana State Health Department a couple weeks ago, and they showed the comorbidities of heart attack, of heart disease, diabetes in people with COVID-19.
That's a good point.
And the health disparities among people.
You want to explain a little bit further?
Well,
so in Chicago too.
In Chicago as well, yes. That they're largely the health disparities of heart attack, heart disease, diabetes, etc. The comorbidities seen with COVID-19 are largely in minority, low socioeconomic folks that live in cities without access to healthy food. They take public transportation even during COVID-19 to get to work, and they have lack of access to healthcare. And these comorbidities were much more prevalent in that population. But they exist, obviously.
Much higher rates.
Yeah.
Just like with higher rates of heart attack, higher rates of stroke, higher rates of other debilitating diseases. Now, that's probably not genetic. In fact, there's been plenty of evidence to indicate that's the case. But there is a significant epigenetic component to a lot of these. Any comments about that?
No, I'm talking more about lifestyle, and also crowded housing.
Yeah,
is another.
Well,
I think you covered the genetic part.
Well, I will. I'll actually add the epigenetics, because the epigenetics is the link between lifestyle and genetics. What they've demonstrated is that, number one, in lab animals, if the father is obese at the time of insemination, that the offspring have a much higher risk for prediabetes. if the human child has a weight of greater than 8.5 pounds, much more likely to have prediabetes as they get older. So again, a significant link between genetics and lifestyle. I was a 10.5 pound baby. And so even though I had a BMI of 21, 22, as I got in my late 50s, I still developed significant insulin resistance.
And since we were talking about children today, I kind of thought that Dave's question was related to how that occurs with children that you just addressed.
And again, you see significant increases in diabetes and prediabetes associated with socioeconomic levels. So
well, I'm going to have to take off.
Okay, well, thank you again.
Nice seeing you all today.
Thanks, we'll see you. So Dave Murphy, thank you very much. It's not fear-mongering, it's providing current information. Now, I'm sure that somebody's going to use some of that for fear-mongering, but I'm not convinced that any of the news outlets that we saw were doing that so much, again, as providing information. If you're head of responsible for the ICU care for pediatrics for an entire country, you're going to see some of these cases, and people need to be aware. The providers need to be aware that this is happening. So thanks again, Dave. I appreciate it. The Black Duke. Not surprising that children are showing COVID-19 symptoms. Immune system reacting differently. Silver D, get some sunshine, fresh air, and stop watching mainstream media. I would agree with that. Order out of chaos is the real agenda with this COVID-19. Good point. The Black Duke, I have high vitamin D levels. I take 12,500. I think you're probably meaning international units. Rarely go outside. Iron is low and not normal, or low end of normal. So I actually started getting up into the 90s at one point, and I backed off a little bit. But yes, it's we used to think that 20 to 35 was, quote, normal, and that was like a decade ago. The labs are still using those as normals for the most part. Some of them have become a little more enlightened, though. Stack 9866, opinions on intermittent fasting to help immune system and lower blood sugar. Very clear opinion. I think intermittent fasting is a big deal. I think it helps immensely. You know, quite often you see me focus on some of the larger, more respected medical journals like New England Journal of Medicine, Nature Magazine, JAMA, some of the others. But I will tell you, quite often it takes a while for those more recognized science magazines to get it. Intermittent fasting was just one of those. Intermittent fasting has been discussed, and it's been described in a lot of medical journals, science journals. And I just saw the first one on it the day after Christmas, I believe, in the New England Journal on intermittent fasting. They had a great article on it. I covered it. If you'd like to see that, let us know. We can get you that article. Basically what they're saying is, you know, even in some of the older, as in decades old research in the New England Journal, they were talking about caloric restriction and it being a big deal. And you remember that was the thing 20 years ago. Well, what they were showing was they went back and looked at some of the data, and they were actually putting some of the lab rats through intermittent fasting. So what they were doing was they were feeding the lab rats once. They were feeding them less than what they were normally feeding them. So and the rats were competing over the food. So they do that small feeding. The rats would come in, eat all of it up, and then they wouldn't eat again for another 24 hours. What they realized that they were doing was setting up intermittent fasting. That article, again, I went into some of the details. It was very interesting. It went into some of the metabolic components. It's been demonstrated that if you go through some of this intermittent fasting on a regular basis, in other words, go back and forth between having plenty of calories and not having enough calories, you start going back and forth into appropriate anti-inflammatory metabolism. Your inflammatory markers drop. A lot of good things happen. Your body goes into some autophagy, auto meaning self, and phagy meaning to eat. So you're basically starting to burn things like lipids and fats and inflammatory things that shouldn't be lying around, but continue to lie around as long as we've got too many calories coming in most of the 24-hour period. So intermittent fasting is a big, big deal. And even some of the ivory towers of medicine have begun to acknowledge and say, yeah, you really should be doing that. It helps with your immune system. It helps with inflammation. Dave Murphy, yes, Janice, that was the context I was looking at. Thank you, Dave. Doug Smith, what do you think my risk is as a 73-year-old? My nutritional status is likely in the top 1% for D3, magnesium, C, and other nutrients, plus lots of fruits and veggies. I run 130 miles per month in the South Nevada desert. I bet your risk is much lower than the vast majority. Excuse me, I'm getting a call from Carl that he's actually co-hosting. So that may, Carl, have we got a problem? Ooh, what happened? Oh, okay. So I will close it out, but we're still okay. Thank you, Carl. So as I mentioned before, Carl is in the Philippines, and sometimes they have some power outages. That's what he's got going on. Doug, again, as a 73-year-old running 130 miles per month in the South Nevada desert, I'm impressed. Top 1% for D3, magnesium, C, and other nutrients, fruits and veggies. So it looks like you're doing great. However, I will say this. I've never met somebody whose lifestyle I felt couldn't, and whose condition I felt could not be improved, myself included. There's a lot of stuff I could do better. One of the major questions that I have for you, Doug, is a question similar to what I had. You know, speaking of running, it was about the time I did an ultra marathon. It was 40 miles. Yes, it was in the mountains of Kentucky. And it was about that time that my own prediabetes began to get worse and worse. So do you know for sure that you don't have prediabetic problems? And I mean, if you or anyone else labors under the false belief that running is going to protect us from prediabetes and therefore protect us from heart attack and stroke, do I have to repeat the name Jim Fix? Now, I don't think that running increases your risk, even though I think Fix was running when it happened. And people, yes, have had heart attacks when they're running, but it's pretty clear. Running does not increase risk. It clearly does decrease it, but it's not an assurance. Bottom line, you need to find out. You need to stop guessing and start testing. Get a Freestyle Libre and or do a Kraft insulin survey along with an oral glucose tolerance test. Find out how your body responds to a push or a stress from glucose. Thank you again. 60, your D3 is 60. That's a good level. I recommend 60 to 80. Bob Mester, IF rocks intermittent fasting. Dave Murphy, my vitamin D has been 3 to 100. Report has 30 to 100 as being normal. I've been taking 15,000 IUs daily to get to my 87. Again, I would agree that 87 is a good number too. Simra Basivan, thank you for your wonderful work that we can listen and learn from you. Thank you very much for the acknowledgement, Simra. Dave Murphy, Stack 9866, I've been IF keto carnivore for over a year. I was getting ready to say, didn't you lose a few pounds, as in over 100? So from a personal point of view, I highly recommend IF. Did you do any alternate day fasting too, or low carb or anything like that? Interesting question. Emma Zine, good to see you back again, Emma. How about the free Android app, iCare Health Monitor? I've used it for over a year to measure oxygen level, heart rate, pressure, lipid level. Can you check it out and evaluate it? Well, I don't have an Android. I used to have one when I had, when I had some of my corporate jobs, I had an iPhone and an Android, but fortunately I'm, quote, retired again. Doug Smith, blood sugar, normal, latest physical, 95, I think. So Doug, great, that's good. I'm glad to hear it. Fasting blood sugar should be 90 or below. Having it over 90 indicates insulin resistance. The other thing I would say is fasting blood sugar is inadequate for measuring your response to what happens when you get slammed with, when you get stressed with glucose. It's an old-fashioned test. It's old school, but hemoglobin A1C and fasting glucose are not at all a replacement, or they're not sufficient for saying whether or not you have prediabetes. And prediabetes causes like 80% of plaque, therefore 80% of heart attack and stroke. Again, if you can do that with us. If you want to become a patient, you can do that. If you want to just do a webinar, you can call us. Check out our website. That was one of the things that I showed in the very beginning, and show each show that we have to help folks understand. The vast majority of primary care docs in the U.S. don't understand prediabetes very well. That's been documented already. It's not that I'm hating on other docs. I actually have made a living out of recruiting and supervising other docs. They're humans like the rest of us. Bottom line is, your typical primary care doc in the U.S. doesn't understand blood sugar and prediabetes. And just getting a fasting blood sugar, again, the fact that that's what you quote to me makes me worry about what your doc has told you, and makes me suggest sign up for our webinar at least, or become a patient and we'll find out. Stag 9866, I've been fasting for at least 18 hours daily, along with PQQ in the morning with resveratrol and NMN. Wow, you are just hitting every one of the David Sinclair mitochondrial supplements, aren't you? I don't see niacin in there, but I do see NMN and resveratrol and PQQ. I take vitamin D3 and K2 with coconut oil when I break the fast. Good for you. Now, I would wonder why you take that when you're breaking the fast. I guess it's because it's got coconut oil in the pill itself. Interesting. Jackie Shaheen, I'm a natural health advocate and will say that the health and wellness information provided on this channel is exceptional in the promotion of balancing the body via diet and healthy lifestyle. Well, thank you very much, Jackie. I appreciate that. As you may tell, I have done more of the classical or standardized type of training and even career. I went through med school at the oldest continuously open med school in the country. And no, it's not Harvard. It's MedU of South Carolina in Charleston. Interned at Charity Hospital and got out in doing some ER work. Within less than a year, it became very clear to me that the vast majority of things bringing people into the emergency room were things that should have been delayed or prevented entirely. So I got really motivated, really focused on providing more prevention. Went to Johns Hopkins at that time, one of the best places for learning, again, old school standardized prevention. learned it there and still do use a lot of that. I've been a career medical director, several different jobs where at Premise, for example, was the chief medical officer for a group of about 700 docs. At MDLIVE, 800 docs. At Physician Partners, the chief science officer for a group of about, a couple of groups, one of them with about 1,200 docs, the other one with about 700. So again, one foot in standard medicine, the other foot in prevention. Now, some of my old friends would gag if I use the term functional medicine. And I'm not going to get into all of that political junk, political stuff within the profession. But the bottom line is most standardized docs don't understand prevention very well. Either the standard components of prevention, which involve things like predictive value of a positive, predictive value of a negative, which you see, which is a big, big component of this warning about stress tests are not going to predict your heart attack. Most docs also don't know much or anything significantly about nutrition. That's, in my mind, one of the major reasons why intermittent fasting took so long to get to the New England Journal. So, unfortunately, they're ignoring a lot of the science. Supplements are a lot more than just expensive urine. So thank you again, Jackie. The Black Duke, carnivore diet also shows good results with inflammation issues. It does. It's one of the significant elimination diets when you think about it. You're eliminating some of the big items like glutens, for sure. Now, a lot of people are going to look at that and get really sideways. I'm not a carnivore diet person myself. I've got a few people that are on the carnivore diet, and I can understand completely how you would say what you just said, Black Duke. Dave Murphy, low carb and some extended breakfasts or extended fasts. Mostly OMAD. For those of you who don't know what that means, that's one meal a day. And I've never heard of OMEOD, but I'm guessing that means one meal every other day. Extended up to 132 hours, once every 6 to 8 weeks. So thank you for sharing that, David. One of the things I will say is, since I started getting the channel has grown, and most of my patients that are now coming in from the channel, it's weird. I had to learn something new. I had to learn a situation where people would come in, they'd have significant plaque, but everything would look good now. Their OGTT would be normal, their insulin resistance would be normal, their BMI would be great, and I'd find out, yep, they were sort of like David. They've lost 30, 50, 150 pounds over the past year or so. So they laid down that plaque at a time when they were in an unhealthy phase. After getting a deeper focus on their lifestyle, they had corrected things. So I'm seeing a lot of that these days. And again, a lot of that on our channel. Thank you for sharing your experience, Dave. Nick Christopherson, time-restricted eating to 8 hours a day and following circadian rhythm is how I got my A1C from 10.3 to 4.7 in 18 months. Nick, that's amazing. I'm so jealous. I'm so jealous. Mine still hangs around 5.5, a 5.4, 5.3, which is not bad. Most docs would say that's great. Well, you want it below 5, and I haven't been able to get mine there. Okay, so pardon the digression. When it gets dark, no eating and start to prepare for bed. Sun's up, I'm up. Thank you so much for sharing that, Nick. We appreciate that. Lorraine McDowell, thank you for advice and medical knowledge. Your site is excellent. Keep up the good work. Thank you so much, Lorraine. I appreciate the acknowledgement. Dave Murphy, I follow Dr. Boz at this point, and I remember I saw you on there last week. At an extended fast at least once a week to get my Dr. Boz ratio to under 40 GKI. OMAD the rest of the time. Thanks again for sharing that. And Dr. Boz, I'm blanking on her. Is it Aunt something Bosworth? And she gets way deep into the keto lifestyle and helping coach people through that. I've spent some time on her channel. Amazon, my wife says you can get it on the iPhone. Try it. I have been on keto over 80 years. Dropped 80? Dropped from 183 pounds to 143. Blood pressure is 115 over 78. So that means you're over 80 years, I guess. But 183 down to 143 and blood pressure down to 115 over 78. Really, really good numbers. And that's what you tend to see. When these people lose that weight, they also lose their high blood pressure. The Black Duke, impressive, Nick. Joe Riley, Dave DBR under 40. Very, very cool. I believe that I was undiagnosed pre-diabetic and most likely diabetic. I bet you were, Dave. Doctors never tested me after the weight loss. My A1C is 5.1. I hate to see what it was before. I would too. I see it all the time. Had a calcium score of 2,600. Yep, that's pretty classic for what I get in with my new patients. That's what inspired these lifestyle changes. Yep. And it's seeing something like that that gets people started. Dave Murphy, Joe, is this AM, it was 37. Joe, 98%, 80 beats per minute, 98.4 degrees. Well, good for you, Joe. Annette Bosworth, thank you, Dave. That's correct. Guys, it's, I keep thinking we're going to get this to half an hour and keep it there, but I've gotten it to half an hour a couple of times. It's better for reviews, but as we shared before, Carl's setting up a system where he can cut off some of the the daily program, the main program, and then set that up for people that don't have an hour to go through one of these. Thank you so much for your interest, and we will see you tomorrow.